Okay, welcome everyone. I'm going to hand over to Professor Andre Mochan. Andre is the head of neurology here at the University of Witwatersrand, Krasani Baragwanath Hospital. And over to you, Andre.
Yeah, thanks again, Kirti, and thanks again to the audience, and a privilege being part of this series again, and really honored to host it in a way, although with very little of my own merit. Really, truly, we're the busiest and biggest neurology department in the country, training registrars, students. So we are immersed in stroke care, have a specialized motor neuron disease clinic. So we have kind of nice little broad spectrum of acute and chronic neurology that we're dealing with. And this brain health experiment has really brought, and thanks to Kirti, some different perspective to us, and we are really gladly associated with this. So it's really exciting to look at health promotion and illness prevention rather than what we normally do the other way around dealing with the consequences of ill health and all of that. So it's a really wonderful perspective, and thanks again for allowing us, Kirti, to do this together. And we really proudly and happily supporting this, and really want to go forward being part of this, and especially looking at now this happening on the African continent and having this Pan-African partnership almost going, and really to support and develop this concept of brain health on the continent. So thanks for that and allowing that. And over to you, Kirti, because you're really the engine, and thank you for doing that.
Thank you, Andre. So just a brief background, I did neurology at the University of Witwatersrand with Andre throughout those years from the mid-1990s as a medical student, actually, Andre. And so it really is good to be actually hosting this with the University of Witwatersrand and the Division of Neurology, as we center Pan-African voices on this collective vision to support better brain health. This is the second in our series on brain health perspectives. And this particular webinar will focus on Lifecourse approaches or strategies to support brain health. We wanted to actually look at this across a life course because we understand that a healthy brain really is dependent on more than just us as we get older. We really have to consider what we do as children and throughout our lives, basically. But it's also quite a complex challenge to consider. How do you actually bring in all these factors across a life course to support better brain health? And so that's what this conversation is really about. And also, there's so much of this competition that happens within these different medical silos and across different age silos as well. So is dementia and responses to increasing rates of dementia more important than child nutrition, which is important for brain health? And so part of this vision is actually to see how we actually collaborate across these different silos instead of compete for limited resources. How do we strategize within this group of passionate people who are determined to support health equity? How do we actually strategize and use these resources effectively and equitably? With that, I'm going to start with the first speaker. I will extend apologies for Professor Jaco Hoffman. Unfortunately, he had to cancel. And I'm still sure that we are going to have a very dynamic discussion. We will start with the speakers, and then after that, it will be followed by a Q&A session. So first speaker today is Dr. Aya Ashour. Aya is a neurologist and a Global Atlantic Fellow in Equity for Brain Health from Egypt. Her current work focuses on the challenges facing brain health research in the Middle East and in the North Africa region. She is a working member of several brain health awareness programs and initiatives in Egypt, and she aims to bridge the gap between the growing scientific research and mental health practices in the region. Over to you, Aya.
You're on mute. Oh, sorry about that. Thank you very much, Kirti, for the introduction and for the invitation to join this interesting panel. And thank you, especially Kirti, because you've always been the flame in connecting us across Africa and creating the African Brain Health Network. So thank you very much. I'm very pleased to be with you here. Allow me to share my screen. I'm pleased to be part of this series. I'm going to talk briefly about the brain health determinants in Egypt and how the current status is now. This is my simple identification card. I'm a lecturer of neurology in Njamnshi University in Cairo, Egypt. I'm a senior Atlantic fellow for equity in brain health. I'm a board member of the Mental Health Research Network of Egypt and the Dementia Support Initiative in Egypt. In 2022, the World Health Assembly published the Intersectoral Global Action Plan on Epilepsy and Neurological Disorders, and they stated their plan as achieving a world in which brain health is valued, promoted, and protected across the life course, where neurological disorders are prevented and diagnosed and treated. Premature mortality and morbidity are avoided, and people affected by neurological disorders and their carers attain the highest possible level of health, equal rights, opportunities, respect, and autonomy. Well, brain health concept, the concept of brain health itself is very new. Actually, I've never heard about the brain health concept before until I've joined the Global Brain Health Institute. That was like 3 or 4 years ago. I've been a practicing neurologist for like 13 years, but this new concept is very important because it bridged a lot of gaps that existed between mental health and neurological disorders and childhood and old age, different genders, equality in receiving mental health. This is a very nice figure from a paper published by our GBHI fellows and professors in 2021. They describe the brain health as multi-dimensional and dynamic process. It has antecedents, it has attributes, it's a continuum across the lifespan. It's multidimensional. It is influenced by ecological and biological determinants, and it should result in life, quality of life, and good well-being. The WHO had a position paper in 2022 that described the brain health determinants. They stated that physical health, healthy environments, safety, security, learning and social connection, access to quality services are the broad terms for brain health globally. These are very wide terms and of course are affected by the region, by the culture, and by the attitudes of the population and the governments as well. Egypt is a very large country, population-wise. We are the third in Africa after Nigeria and Ethiopia in population. We are 105 million as like 2 days ago. We have a growing population pyramid. We're a growing nation where the infants and newborns are more than the elderly. And this shape of our population, of course, have influenced how the health policies are taken and how we deal with the health issues in our community. So I'll speak now about the determinants of health and of brain health in Egypt in broad terms. The health sectors in Egypt are the public sector, the private sector, and the NGOs. The public sector falls below the Ministry of Health and Population, and of course, the private sector is also guided by the Ministry of Health. The NGOs, which are not usually mentioned in the official health sectors, however, they play a very important role, and I'll speak about it later in the presentation. That was very evident, especially in the COVID-19 pandemic. We know that there are certain disorders that affect our brain health, and these are the morbidities and mortalities, the highest causes of mortality, mortalities in Egypt. The highest cause is ischemic heart disease, which is similar to the global causes of mortality. We have a high incidence of cirrhotic liver because we had in the 19th and early 20th century, we had an endemic bilharziasis infection from the in the Nile, I would say, tributaries. And unfortunately, we have a large number of stroke incidents and road traffic incidents, especially in big cities. Since we're a growing nation, there is usually a more focus on the health of the mothers and the children and the youth, of course. So most of the health awareness campaigns and the designated funding to the health sector is directed towards the youth. Female genital mutilation campaigns, polio eradication programs, immunization programs, substance abuse campaigns for sure. These are some like bright points about campaigns targeting brain health, whether I mean intentionally or non-intentionally, like immunization itself and protecting children from getting chronic disorders from mumps or measles or rubella or whatever, and that can directly affect their central nervous system, is a target to achieve brain health. So this is something that we are proud of in Egypt about caring for children. Also, the substance abuse campaigns and the smoking campaigns, anti-smoking campaigns that target the youth in the high schools and universities. And we can definitely understand the relation between the substance abuse and mental health or brain health. The Global Burden of Disease study in 2019 had estimated the prevalence of a forecast of dementia in 2050 globally, and have studied the following risk factors: the body mass index, the fasting plasma glucose, and smoking. And these were the results. We can see how Africa and the Arabian Peninsula are one of the hottest areas, which we have or expecting to have a percentage change in the numbers of individuals diagnosed with dementia in 2050. What is this change? What is the cause or behind this change? Speaking of our area of like Africa, we can see that many of it, big part of it is due to change in the population itself, the population aging, and due to the risk factors that exist. Like we still have smoking, we still have obesity, maybe not, of course, or at least nutritional disorders. And the diabetes is underdiagnosed and under-controlled. Another positive or shine or a positive side of this thing is that there are public policies that are taken, or steps that are taken, and policies that changed. We had in 2021 a screening for 2020, a screening for hepatitis C and other non-communicable diseases in the community, including diabetes mellitus, obesity, hypertension, and hypercholesterolemia. And that was very effective, and we have touched it personally in our clinics, that many people were screened totally free in the primary healthcare sector for these conditions, and received totally free treatment. They received interference for hepatitis C and received monthly medications for diabetes mellitus, hypertension, and hypercholesterolemia. Also, during this campaigns, there was, and still it is still ongoing, there was screening for anemia, obesity, and stunting among school children. This was also a very good step because, as we all know, brain health starts from the young age, and it's a lifespan and a continuum from youth to elderly. So diagnosing these conditions early and correcting them, providing better option for the children to grow in a nurtured environment and free of brain disorders was a very good move. Currently in 2022, the Ministry of Health stated that we have like almost 70% millions who have health insurance. We have health insurance for school and university, school children and university students. We have state health coverage for immunologics and biologics for treatment of neurological disorders and other, of course, but I specifically mentioned neurological disorders like multiple sclerosis and thrombolytics therapy for stroke, which can be given completely free in the public health sector. Yeah, I have to mention the role of the non-governmental organizations in taking care of the health of the Egyptians. During the COVID-19, we've all seen how globally, how all the health sectors were impacted by the great numbers of the patients and the limited resources and the limited beds. Of course, in Egypt, it was the same, but there was multiple NGOs who worked to receive and connect the patients with physicians. We had like a parallel network of NGOs and charity doctors who treated, managed, and followed and searched for ICU beds for patients completely free, just trying to help. It was like a parallel health system with the private and the public sector. So it was Mercel Foundation is one of the very effective NGO that reached a lot of patients and provided help to many. Another problem that is determines the brain health in Egypt or endangers the brain health in Egypt is, of course, the pollution. The air quality in big cities, especially Cairo, is terrible. Here's a picture of Cairo from upwards, from above. I've been, while I was in San Francisco during my fellowship, I was asked by a US citizen if I can see the pyramids from my house. So I just laughed. It was not even possible to see what's in the next road or then the nearby district. It's totally impossible unless there is heavy rain and all these pollutants are cleared. We are the 27th most polluted country in the world in 2021. So there is major problems we are facing is the desertification. Egypt was essentially, especially in the Delta region and across the Nile Valley, was an agriculture country, and we used to have a large area of greenery and cultivated lands, but now because of our expansion and the population, these green areas are converted into cement blocks and houses. This is also goes in parallel with the lack of design and lack of planning in the government itself that does not put in mind or in consideration that they need to create more green areas. Actually, they are removing the green areas from the big cities to increase the infrastructure. And we are all directly being affected by this. There are a lot of World Bank funded projects to overcome this pollution, but it still needs a large push from the community and the government as well. The housing and the access to clean water, the industrial waste, the quality control and food industry is very variable in Egypt. Egypt is, as I said, is a very big country, and it differs from rural areas to urban areas. There are certain areas where housing is not healthy at all and is very crowded, especially, of course, in the big cities. The access to clean water is compromised in the some of the rural areas that do not have like water pipes and good sewage system. Of course, the industrial waste and the quality control and check over the factories and the food industry. One of the most important health determinants is the safety, whether the safety is like physical safety or financial safety, social safety. In Egypt and like many actually of the global South countries, we are we are how do you say, like a family-oriented community, and we care for each others, and we have like even the crime, if this is the slide for the crime or the homicide data, it's considered low, and of course we have like security issues and crimes, but still we don't have these compromising crimes for brain health. But the real issue is the financial security. Of course, we are facing a great economic turbulence right now, especially this year and the previous one. In 2019, the official estimates that about 30% of the Egyptians are poor, and this even got worse by the increased debts and increased inflation and the depreciation of the Egyptian pound against the US dollar. Today, speaking of today, many of the middle class Egyptians suffer from inability to support their families' schooling or access to good food or healthy food. And it is a very distressing problem. One of the very important brain health determinants is the cognition and the learning and education. Fortunately, Egypt has gone along a lot of improvement in education, and currently the literacy rate is 73%, and it's much more improved in the recent years. The social support is important even in creating the social connections and the, how do you say it, like the pruning and the nurturing of brain health. We are a very traditional society. We still care for our family members, not just the elderly. Maybe this paper was talking about the elderly, but our family support is very high. We are against the youth separation from their families, and even when traveling inside the country or migrating from rural areas to cities, you will find the family migrating together. If for instance the young man is joining the university in Cairo, they all move from the rural area to join with him, or he at least get spend the weekend with them and get back to his college. And so is it all that bright? Of course, no, we have challenges. First of all, there is no epidemiological data that tells us what is wrong and what is the real challenges are. Like, all this presentation was made upon the research done by the UN or the World Bank data. Very little is made by the Egyptians themselves. We are not addressing our problems, and we are not searching for the solutions. The second of which, we are the underdiagnosis of the brain health risk factors and the brain health disorders. The mental health disorders and the neurodegenerative disorders are still treated as if they are an act of magic or possession, and so and this also creates a stigma. There is an unfriendly environment and a lack of inclusion of those with brain health disorders in the community. We still have very slow policy change and policy implementation and policy supervision. We have pioneers, like those who address a problem and write an action plan and make a policy change, but in a sporadic form. There is no national action plan or national inertia. And of course, the lack of public awareness. In a countrywide survey by the Ministry of Health in 2018, we found that a quarter of the Egyptians had mental health issues, mostly, of course, where it was anxiety and depression. About 30% of those having mental health issues were having it due to substance abuse. I've been just talking from a few days with a friend who's a practicing psychiatrist in Egypt. We have these days a regular electric outage every day. There is like an announced schedule by the media that each district will have an outage at, for instance, this district from 1 to 2, the others from 1 to 2 to 3 p.m., etc. And we were speaking how much this creates an anxiety. Like you have to modify your schedules, your meeting schedules. You have to modify when you ride your elevator or cook, for instance, because an electric outage might happen or might not. So this actually creates an anxiety for trivials. So with the financial insecurities, the Egyptian individual is in constant anxiety that will definitely can affect his brain health. Just a minute, excuse me. I'm about to finish. Well, as we said, the public knowledge is still in the attitude towards the brain health disorders. We still name the person with schizophrenia as crazy. We still call dementia in Arabic as a word similar to idiocy. So we have a problem in identifying the disease because of the late diagnosis. This is a project we worked upon in the Mental Health Assessment Network of Egypt. It is not published yet, it's under revision, testing the public knowledge of dementia among the sample of Egyptian population. Okay, well, I'll have to take a minute, sorry.
While I just take the break, just to say, really excellent presentation. It almost feels like I'm living in Egypt. I can relate to so much of what you're saying, particularly the timed electricity outages and the stress that it actually causes. But yeah.
Let's wish I could complete the presentation, yeah. Okay, so we found that about 30%, 34% of our participants, of our 782 participants, had low knowledge of dementia. They didn't know what dementia is, or didn't know what the symptoms are expected to be, or that if there are possible management for this. In the Dementia Support Initiative of Egypt, founded in 2019, we started with the generous funding of the Ibra and Dana Foundation, and we had 2 awareness campaigns in 2021 and 2022, a series of online events and physical events. We also had the Brain Awareness Week funding, and we have the Ibra Ambassador Program funding to raise the awareness for dementia among the public, based on the project we've already made to test the public knowledge, aiming at providing more awareness and better determination of what brain health is and the risk factors of brain health compromises are. And thank you.
Thank you, Aya. Really an excellent presentation. Gives us a wonderful overview of brain health, particularly with local factors. But again, so much that I could relate to it. I'm sure many other people in this group could relate to as well. I really appreciated that you included so many different complex factors, looking at the infectious illnesses, the non-communicable illnesses, the environmental factors, food and income security, again, a real issue here in South Africa that I think we as a health system need to start prioritizing. But also that you included resources that you do have, and something, again, I think we have in common here, namely those intergenerational integrated communities that promote social support, and how important this is for brain health. And potentially going forward, how do we actually support this resource that we have? So thank you. We're going to go to our next speaker before we open for questions. And the next speaker is Professor Alfred Njamnshi. Professor Alfred Njamnshi is a Swiss board certified neurologist and clinical neurophysiologist, the professor of neurology and neuroscience in Cameroon. He is also the founder and executive director of the Brain Research Africa Initiative, which is a development partner of the Africa Union Commission and a member of the International Brain Initiative. Thank you, Alfred, for joining us again. We really welcome your insights.
Thank you very much, Kirti, and thanks to Aya for this excellent presentation. As you said, Kirti, I identify with most of what she was saying. Excellent presentation. I will keep to the tradition of conversation, just share a few thoughts with you. And my topic for reflection is healthy brains from the womb to the tomb. This is a program that we have at Brain Research Africa Initiative, as you have rightly introduced. And when we were putting in place this program of research and activity, some of our members were a little reluctant that we should use the word tomb, because many people don't like to think of death. But that is an inevitable thing, and I think that we finally agreed. We wanted to find words that rhyme, so our project, we adopted the phrase from the womb to the tomb, healthy brains. We started, and as you know, brain is part of the African Dementia Consortium, and brain is leading the African project on dementia, the recruitment and retention project with the collaboration with the University of Ibadan and the University of Miami in the US. We have 9 African countries that are working on that. So in the next few months and years, we're going to be able to provide data. I know that Aya talked about the absence of data. We are going to be able to provide some data from 9 countries, 8 English-speaking countries and 1 French-speaking country and 1 bilingual country, English and French, which is Cameroon. We're looking at adults above 60, and we're going to get clinical phenotyping of dementia, especially Alzheimer's dementia. And we're also collecting genetic material so that we can do genome-wide studies to know some of the genetic signatures and variations in the African populations as far as dementia is concerned. That is something that we have been doing, but in the past, we've also been working on epilepsy, especially among the adults and the youth and children. And more recently, I'm going to tell you more about what we have decided to do with pregnant women and unborn babies to be true to our program of seeking to have healthy brains from the womb to the tomb. One of the things we've been looking at for the past 25 years or more is the relationship between epilepsy and onchocerciasis, which I may be able to share later on in one of these series if we get there. But let me just say that we are one of the only groups in the world that have done 2 cohort studies that establish the temporal relationship between onchocerciasis and epilepsy with a dose effect, which means that children that are exposed to onchocerciasis in their childhood would develop epilepsy later on in life. And this has led to the concept of onchocerciasis-associated epilepsy that we have developed with colleagues in France and with colleagues in Belgium. And we are trying as much as possible to see if we can find the exact mechanisms that explain this. Many groups around the world, especially in tropical medicine, are working to find out this, but that is still an open question. We've not yet been able to determine exactly through what mechanism, but lots of data, epidemiological, and even the fact that control programs with ivermectin reduces the frequency of epilepsy. So that we have been doing in adults and young people. While working on onco and epilepsy, we also discovered that children who have onco and epilepsy develop cognitive problems. And we were thinking, the first idea was that the cognitive decline in children who have onco and epilepsy might be due to the epilepsy or might be due to some of the medication like phenobarbital that is used in epilepsy. But to our greatest surprise, when we did a case control study, which is published, we discovered that exposure on its own to onchocerciasis leads to cognitive impairment in children. That was a very interesting finding, and we are now working on that. We have just completed a study that we've been looking at people in rural areas living in onco-endemic areas that have epilepsy or do not have epilepsy but have cognitive problems. And we're trying to fizzle out the contribution of onchocerciasis to dementia, even in the elderly. And that work is going on, and in the next few months, we will be able to publish and share some of the results of that work. Now, shifting backwards, we thought that we should not only be concentrated with children, youth, and adults as far as epilepsy and dementia and other degenerative diseases of the brain are concerned. We are currently looking at pregnant women in the rural areas, and this is a case control study design where we'll look at pregnant women who are exposed to onchocerciasis and pregnant women who are not exposed to onchocerciasis, and these women must have been living in the onchocerciasis endemic zone for at least 2 years. And we're going to follow them throughout pregnancy, and we'll take one of their children that is about a year old and follow these children up. When the unborn children are born, we would follow them up. And we have had collaborations with colleagues in the UK that have provided us with cognitive assessment tools that are adapted to children of about 2 years old to about 3 years, and we'll be able to adapt and use these tools to follow up these children. And the idea, the question is to be able to find out, our hypothesis is that onchocerciasis affects children even in the womb. And we'll look at the exposed mothers and compare them with the mothers that were not exposed to onchocerciasis and compare the results of cognition, the assessments of cognition throughout their childhood. And hopefully, if we get enough funding in the future, we'll follow them up through youth and through the teenagers and to adulthood, and maybe to see who will develop dementia later on, epilepsy, and other cognitive problems. So that is, in a nutshell, part of the program that we have developed in Brain Research Africa Initiative, looking at some of the factors, especially environmental factors, coupled with genetic factors that would determine brain health from the womb to the tomb. And as Aya mentioned, financing is a big problem. Most of these studies that we are doing in brain, and we have been doing them for the past 25 years, are funded by foreign programs, European Union programs, the NIH Wellcome Trust, and other foundations. But as I said some time ago in the US when I was presenting some of our data, we look forward to a time when African governments will be able to provide the 15% or so of their budgets into health research, and that brain health will be able to get some of this money for us to be able to fund research to get epidemiological data, clinical phenotyping data, genetic data, and all of these multiple factors that we might even together be able to do multi-omics studies of our populations in Africa because the African populations are not usually included in multi-omics studies, global studies. And that way, that is something that BRAIN has started as an initiative to begin to provide some research data that hopefully will shape policy, not only in Cameroon and not only in the Central African French-speaking sub-region of Africa, but also in West Africa, North Africa, Eastern and Southern Africa. And since we work together as a development partner with the African Union, I think that these conversations we have here, continuing to work together, and some of the thoughts that we shared at the beginning of our formal meeting would knock the doors of the diplomats and the administrators and the politicians, and we would be able to, in the future, to be providing, describing our problems, finding solutions for our problems, and why not using some of those solutions that we find to share with the rest of the world in areas that have common problems with us. So in a nutshell, I just wanted to have this conversation with you to share these ideas that we in BRAIN have developed these programs to look at factors that affect brain health from the womb right to the tomb. And I would like to stop there, and I'll be available to answer some questions. And in the future, I'll be able to share the results of these studies that we are currently undertaking with you. Some of the past studies have been published already. Thank you very much.
Thank you, Alfred. Again, a very, very insightful talk from you. And really, thanks for actually showing us how, again, what we're exposed to potentially even before we are born is going to affect our brain health, and how we need to start looking at that continuum and where is the ideal point for us to actually respond to support better brain health. What you described is quite complex in terms of even understanding it. What I wanted to know before even I open for questions was, when you mentioned exposure, do you mean direct infection or just exposure to the infectious disease?
Is that to me, Kirti?
Yeah, to you, Alfred.
Yes, exposure to onchocerciasis is infection, and we do that in two ways. In most of our studies, we do skin snips for onchocerciasis to find the microfilaria in the skin, and we can actually count them, and we are able to determine the dose per skin snip, and that's how we can quantify and relate that to cognitive impairment. But the more important for public health studies, the more important thing to do is to look at the antibodies to the antigen. The OV16 rapid test would tell you more about people who have been infected, even though they might not still have the parasite and they might not have active disease, but you can know that they have been exposed in the past. And sometimes, since we don't yet know the mechanisms, having been exposed, even if they are not having the active disease, through immunological or other methods or other mechanisms that we don't yet know, they might be developing brain complications of a disease that might not still be active by the presence of worms. So we use the two, OV16 rapid test, and then skin snips for the microscopic examination and count of microfilaria in the skin. So it's actual infection.
Perfect. No, thanks again, Alfred, because again, it shows how what you have locally is going to determine your response to brain health, and potentially a model for us in these different settings. I'm wondering if there's a parallel with neurocystic psychosis and its impact on brain health and cognitive function. We have very high levels, endemic levels of neurocystic psychosis in South Africa, actually, and high disease burden in terms of epilepsy is due to neurocystic psychosis as well. So very interesting in terms of what you're doing, like responding even before in terms of maternal exposure to try and change the brain health trajectory. So thank you for those insights. I'm going to open the discussion up for questions. Wambui, if you could just help me to let me know if there was anybody who did have a question.
Yes, Olua Gbemiga has a question, and I think you can raise it the mic, please. Yourself, unmute yourself and ask the question.
Do you mean I should talk? Hello?
Yes, please.
Okay. Yeah, so thank you, Prof. I've read a lot of your articles, and then I feel so inspired and motivated to be listening to you live and direct. I'm from University College Hospital, Ibadan. So I've been following African Dementia Consortium for years. And then I feel like, I feel homely when I read most of the articles coming from the African Consortium on dementia. So, but my most concerned worries is the fact that we tend to be more Eurocentric in terms of instruments, in terms of data we collect. How Afrocentric are all of these epidemiological data? And does it speak true of African situation in terms of some of those embedded cultural practices? I mean, all of these genetic ideas, genetic terms you've mentioned, my grandmom, who is currently suffering from I'm a medical social worker, by the way, from University College Hospital. So I have a lot of patients who do not even understand all the genetic ideas. How has the African Consortium on Dementia and also the Brain Health Africa have been able to communicate this epidemiological data? And also, what are those Afrocentric instruments we've been using over the years? I have that, it's like a double-edged question.
Thank you. Can I answer, Kirti? Can I just answer directly?
Yes, please do answer directly.
Thank you very much, Oluwa, for that excellent question. You are right. You are right in a sense that he who pays the piper determines the tune. When we get, as I mentioned in my brief conversation, that most of our work is funded by foreign agencies, they would certainly come with their interests, and we have to bear with some of that and try to adapt to answer our own questions. What we have done in the African Dementia Consortium is, for example, for the studies of dementia, is that we have taken time to work very, very hard to adapt the cognitive assessment tests to be culturally sensitive and culturally appropriate. Because if cognitive tests are not culturally sensitive and appropriate, they are meaningless. You would be saying people are demented when they really are not, because you are not using the right tools. So we've been working very hard. It doesn't mean that the problems are solved. And since you are in UI, you can walk to Professor Rufus or to some of the people there, and you would see the adaptations that have been done to make the tests appropriate. And then talking about the genetic and omics part of the thing, whether we like it or not, if we assume, I mean, it's not an assumption, if we accept, it used to be anthropological evidence only, but now we have genetic evidence that modern humans originated in Africa. And if we want to study humans in health as well as in disease, we just have to study them where they originated, on the continent of Africa. But most funded research projects have been done with African Americans or Africans outside the continent of Africa, and the environmental contexts are not the same. So it's important for both phenotypic and genotypic data to be studied on Africans in Africa, and we are working towards that. Another thing that you mentioned is that your grandmother in the village may not worry about that. But if drugs are being developed against Alzheimer's dementia, for example, and we saw data, Aya showed us, and we can upload a lot of estimations that show that in the next few decades, Africa will be taking the lead for Alzheimer's dementia and other dementias because of some of the factors that Aya mentioned. If we don't start to involve ourselves in these studies, our grandmothers of the future will not have access to the appropriate medications and interventions that are available. So we have to be on the page. So I think that I understand from where you're asking that question, we have a double burden of infectious diseases and we have chronic diseases that are with us. We have to face that. We have to face our double burden. And if we manage to find solutions to that, I think we'll teach the rest of the world something we must have learned. And I think that's where I look at our challenge from a positive perspective. We just need to work hard. And more importantly, as Kirti said, work together. Work together because our problems are common. And I didn't mention, but you know that the French-speaking part of Africa is left behind, and BRAIN has taken upon itself to build capacity in those countries so that they catch up with the other English-speaking countries of Africa, given that in Cameroon we are bilingual. Rwanda has joined us, Togo has joined us, and Gabon is joining us. So it's thinking like a unit. The African continent is a unit, and we have specific problems. And I think that if we manage to solve them, they're complex, as we are a complex continent, but we are also a very rich continent. If we work together and figure out some solutions, we can be able to sell them to the world. I'm very optimistic. I hope that helps.
Thank you, Alfred. Very inspiring insights,
Thank
and
you,
I
Prof.
completely agree. Yeah, I think we have so much complexity, but there is the potential to collaborate across this, and we are exceptionally rich as a continent, both in terms of those real tangible resources, but also in terms of the human resources that we have, and this ability to build relationships across these different networks. I think it really can take us forward. Aya, would you like to comment on that at all?
I'll just add about what Professor Alfred said. We need to look inwards, like towards our problems, because I should admit, like our inexperienced even policymakers or researchers or those who are interested in making a change are still copying what is done in the Western or the higher income or the global North or whatever we call it. So we need to have a look in our problems. And as you said, Alfred, there is a lot of common things that we can help each others to overcome. And we don't have to, as you say, invent the wheel. Like whatever starts in Cameroon can be completed in Egypt, can be upgraded in Kenya and whatever. You know what I mean? So this is the solution.
Thanks, Aya. Any other questions? Harshad, I know you had a few comments. I wonder if you could unmute yourself and perhaps just share the comments that you had.
Sure. Hi, Kirti. Hi, everyone. Can you hear me?
Yeah, we can hear you.
Okay. Thank you for an excellent set of talks. I think the Brain Health Initiative, I think, is excellent, especially in terms of the African continent. I think it's something that's sorely lacking. I actually am a pediatrician working in South Africa currently, and I worked for a while in the public sector. I did work in one of the bigger academic hospitals, but the variety of diseases that we saw, it was just that we only focused on the disease itself. We focused on the infectious disease, how to sort things out. But the problem is that it's much bigger. As Aya mentioned, the whole thing about malnutrition is a big problem in our country, but also just the socioeconomic burdens that I think most of us have in Africa. There's a massive impact on these kids. And I think it's just that our policymakers aren't addressing those issues. Like in terms of during the COVID pandemic, as pediatricians, we were very stressed about the kids. They said the kids shouldn't go to school to prevent the spread of COVID. But then all these kids were only getting food, sometimes only at school because of the food programs. And because of that, there was a stress, like, is it worth actually getting the kids who have a lower risk of having COVID and sending them to school so they don't suffer from malnutrition? And I think all these factors are playing a role in it. I think we have, like, the malnutrition is a big thing. I mean, surprisingly, at this day and age, we're still seeing a lot of it. And the other problem is that, like I know, like in Egypt, and that people tend to move as families. Unfortunately, in South Africa, parents are gone to Joburg while the kids are being left in the rural areas with the grannies looking after them. So having that there, the lack of mental stimulation, the grannies looking after them, the lack of parental discipline and all of that, I think has a big role to play in these kids' mental health and how they perform. I think also just the education in our country is also a big problem. I think the literacy rate is low. Our kids don't know how to read, and everyone has to pass. They keep on dropping the pass rate, and you think like, what is this achieving? But people need to be able to read and write, and our kids that are out there are not able to do this. So suddenly when they become adolescents, I think they become much more, like they've become more militant about what's happening to the world. The world's against them. They don't have parents to guide them. I think bullying is a major, major problem in schools as well. And then also just the exposure of kids to drugs, alcohol, and also just social media and the bad effects of it all have severe effects on their mental health. And I think the social media has been a problem. I think there's so much of things on social media that kids are constantly exposed to, and the bullying, the cyberbullying, etc. I think these kids need all this mental health, but mental health is just neglected. It's just excluded from that, and just helping these kids develop that, I think will make a massive difference in our country and basically throughout Africa. And I think this From Womb to Tomb initiative is fantastic. I think that's where we are moving. The reality is that like South Africa has a big population of children. And if we can address the children, we'll have better adults for tomorrow. Like for me, education is a big thing that will help kids and get them to be better adults. And I think the problem is that our countries are not geared up for this to actually help with that. But I think we need research, and Africa is special. We are not European countries, as one of the previous participants said. We have to be where we work together, and I think this is actually a very good initiative. And I think pediatric health is severely neglected. And I think also the people with COVID, like if you look at it now, the 8, 9-year-olds, 10-year-olds are having anxiety attacks, and you think like, really? Like, we're neglecting it. Like you speak to more and more people, and suddenly more and more kids are being placed on antidepressants. But the problem is that we're missing out on those children who we could help by putting them on medication and hopefully sorting them out. And this has a massive impact on their brain health. So that's my few comments. Sorry, it's many, but I hope that does help and give a perspective from my side.
Thank you very much, Ranchod. I think we really do value your insight, particularly as a pediatrician and your experience. And again, centering on those socioeconomic and other social factors that we need to start including in our discussions and our approaches to health. The next talk in October is actually going to look at the economics of brain health. And I mean, my question in terms of provocation there is going to be, should we as a health system be dispensing food? Like, should we, given what we're seeing and understanding the impact? Aya?
Yeah, I wanted to comment on what Dr. Ranchod said, and I kept thinking like, how couldn't I include the mental health issues of the youth in my presentation? Because yes, the social media effect is enormous. In Egypt, it's very powerful, and there are trends that are totally against health. And we have like these suicides and homicides in reaction to trends and challenges over the social media. So this is a very crucial area that we have to tackle, and to make sure that it is approached well, to make sure that the brain health of our future children is better. So thank you for raising this up.
Thanks, Aya. Alfred, do you have anything to share with regard to that before I go on to the next question?
No, I just think that the issues shared by our colleague pediatrician are excellent. We need to work together with gynecologists, with pediatricians. Just in Cameroon, I was very glad to see that there is a society of adolescent health that has been created, and they're having their first congress in a few days to come. That is very, very interesting, that groups are beginning to be interested in youth and adolescent health, which was kind of neglected. So I think that working together with pediatricians and with gynecologists and obstetricians, especially obstetricians, will be very important in this initiative of Lifecourse perspective, which is what brain health is all about.
Perfect, thanks. The next question is from Tendai. Tendai, I'm going to ask you to unmute yourself and ask the question.
Oh, thanks, Kirti. Sorry, I typed it quickly. So I wanted to just first say thank you so much for your presentations. My question was just in regard to Aya, where you mentioned that in Egypt, you value very close family relationships, and so your families have relatively remained intact. So I wanted to just ask, what role does the family then play, perhaps in encouraging, help-seeking behavior, so as to reduce maybe stigma around either mental health or brain health? And also, does the public healthcare system in Egypt also integrate the family, knowing that, seeing that it's something that is a valuable asset in perhaps educating and supporting them when living with somebody with a mental illness or dementia? Thank you.
Thank you, Tendai. We have for instance, like psychiatrists and neurologists deal with the patient and his family. Like we have targeted sessions for families, and we respect their needs. And for instance, in dementia, the caregiver needs, we have specialized psychologists. Of course, it is not in all places, it is more in tertiary centers, but we do target the family to be involved with the care of the patient, or the patient with a person with a disorder in the family, because they themselves have their own burden. So we involve them in the management, and we try to give them their space in like ventilating their own challenges they are facing. Whether like there is an action or a health policy that involves the family, no, or I don't think there is. But it is only an individual attitude from physicians to integrate the family, because actually also especially in mental health disorders, the family is the ones who take the patient to seek advice. And when we target the family education, we are making sure that they understand the nature of the disease. It is not a possession by demons. It is not magic. It is an illness, a disorder, and we aim at the family education to not just like improve the quality of service given to this patient, but to this family, and like spreading the knowledge of the disorder in the community. Yeah, I wish I grasped the question right, and I gave you the answer.
Thanks, Aya. I think it's a very interesting question also, Tendai, because you're right. Having worked in the health system, we do ignore this resource when we trying to help the person in front of us in terms of what the specific illness, and we tend to become quite focused on that. But as Aya mentioned in a presentation, this is actually a resource, and it does actually potentially help people to get healthier. You need those different supports. Sometimes you may even need the different irritations that come with these big group families, but we do ignore it from a health system point of view in terms of how we support people. So very interesting question. Thank you. Alfred, do you want to comment anything on that in particular in terms of whether you include families in your responses? I'm just going to read the comment from Lesedi. And what Lesedi says is, as a young person in South Africa, I think with regards to mental health, especially in rural areas, there isn't the right language to explain what they're experiencing. So, for example, depression, and this potentially needs to neglect. So, yeah, your comments or thoughts in terms of language and semantics, and is there potentially other words in the community that we don't know about in terms of how this is, how we could potentially address it and developing this lexicon? Yeah. Aya, do you want to address it? You look like you have something.
Yeah, yes, it's like this is very irritating for me, because we are trying to tackle this problem in Egypt. Like the word epilepsy, the word dementia, the word schizophrenia, all these disorders have very stigmatizing names in the society, and they are very rooted and very hard to change. The other thing that is that works against us is the media, like the not the official media, but the movies and the series and stuff like that, the radio channels, like all of these, the actors and the actresses, they are not helping with the destigmatizing these conditions. They use the same words. They still like how do you say visualize how the psychiatric patient, for instance, is maltreated inside the institute where he should receive his medication, that he's tortured and he's receiving electric shocks instead of ECT and stuff like that. So we are working against a deeply rooted problem and nomenclature that makes it even harder to destigmatize these conditions in the community. So using the correct words to like, for instance, in Egypt or in Arabic language, the word epilepsy is called as-sara. As-sara means to conquer someone or to being possessed by a higher creature. And even in my practice, I tend to use the word disorder in the electrophysiology of the brain, even if it is longer, but I tend not to say the word as-sara, so that I can even do a minimal change. And we try to change the names of the specialized clinics of dementia and of epilepsy and use the correct nomenclature to disseminate the correct names as much as we can.
I wonder also, and it's possibly one of the talks we could host in 2024 on this, because this is quite an important topic in terms of how we go about addressing it. But I was also wondering, and again, referencing the previous question in terms of trying to center this on different African resources and resources that we have. Because what I'm finding also is if you speak to somebody, but you're saying, let's say dementia, epilepsy, these root words are also not local on any level. Is it the equivalent of asking somebody in Switzerland, perhaps, Alfred, to learn a term in Zulu to refer to epilepsy? Do you know what I'm saying? Like the word is so foreign in terms of context. I understand it's very complex to address, but it's just how do we actually develop a lexicon that makes sense in context, and not just use the terms that we have, but very complex for somebody else in terms of trying to sort that one out. The last question, does anybody have a question? Remember, if you could potentially just help me to identify the person, because I can't see everybody.
I don't see any other question except the comment from Leslie and the next, the response from Ashour. The language barrier and stigma are a very big hurdle. It's definitely a problem that gets neglected, and thank you for raising this. And just so that I have the flow and I can ask a question, as especially the speakers, most of you work in the healthcare settings and you're seeing patients. And I was just having a chat with a friend yesterday, and I was wondering what's the role of healthcare workers in stigmatizing mental illness and like what can be done about that, because I think it's a big problem, and you see a lot of stigma really is embedded in the healthcare system.
Alfred, do you want to perhaps answer that? What's the role of healthcare?
I would say, I would agree with you, Kirti, that we may need to, in 2024, just focus on stigma and language and all these issues, because they are very important. Studies have shown that the use of the word epileptic, that adjective, is stigmatizing. And we have proposed that one of the reasons that mental health has not made a lot of progress in 20 years, in spite of the many resources that have been poured into it by WHO and many others, is because the concept of mental health itself and psychiatry, since it's very associated with that, rightly or wrongly, is stigmatizing. And that's why we opt for the concept of brain health, which sounds more neutral. And I think that a lot of work, a lot of research needs to be done on that. And a lot of work needs to be done at national levels. And when you think of countries like Cameroon with 250 national languages, and each of them, we've done quite a number of things looking at the stigmatization. There's a word for epilepsy in each of those languages that we have studied. So there's a lot of work to be done, working with linguists, working with neurolinguists, and all of that, social sciences, anthropologists and sociologists, and all of this. So we have a lot of work to do as Africans, and we have an exceptionally complex and rich culture and experience. And I think that in a few years, we'll be able to get out something. So it's work to be done. It's work to be done.
Thanks, Alfred. We've come to the end of a really, really incredible session. Before I close, Aya, do you have any final comments that you want to share?
I'm just glad I've been part of this discussion. I've learned a lot from this sharing of ideas, and we're still similar and different. And this is like our strength point. Like we have things we can work on together, and we have these differences that make us as rich, as Alfred said, more rich than other communities and other continents. So I'm looking forward to further and future collaborations that can help us overcome the risk factors and that compromises brain health, and hope we can have a common language and common pathway that we take. Thank you.
Thank you, Aya. Thank you for participating. Alfred.
Thank you very much, Kirti, and thank Aya and all the participants for the interesting questions. I've learned a lot, and I think that this is a learning process for all of us together. And we're in this together, and we will surely win. I usually say that if the brain does not work, the rest does not matter. We have to make African brains work.
It's a great way to actually end. Yes, if the brain does not work, everything else does not work. Thank you again to Aya, to Alfred. Thank you to Andre and Wambui. And thank you to all of you for actually joining. It really does add value to what we're doing in terms of supporting brain health across the continent. What a valuable, rich discussion in terms of the complexity, understanding local factors, understanding systemic factors, and how we can actually inspire each other and form these collaborations across different disciplines, different regions, different ages to support better brain health as we go forward. Our next talk will be on the 3rd of October. And like I said, we'll focus on the economics and socioeconomic factors that influence brain health. I hope that you'll join us then. Thank you again. Have a lovely Tuesday.
Thank you very much.
Thank you.
Thank you. Bye.
Thank you, Kirti.
Thank you, Wambui.